I chose the Vein Center because I started Googling different places to go, and I found the Vein Center on Google, looked at the reviews. I also found the Vein Center on Facebook, looked at postings and saw everybody really had a good experience at the Vein Center, so I wanted to give it a try. I've had some heaviness and pain in my legs for a long time. I thought maybe I was just tired until I saw Dr. Hearn and he explained to me those were the symptoms, and it all kind of made sense. I'm tired of wearing jeans all summer long. I want my legs to be pretty again.
We're going to do Varithena first. That's going to treat the small saphenous vein. And then we're going to do some sclerotherapy on her spider veins with the goal of getting her legs looking and feeling healthy. Get started with a little bit of Novocaine over the IV site, and that'll numb up over where we put our IV into the vein that we're going to treat. That's just below the surface. This is the guide wire that goes into the vein. Over the guide wire threads the IV. So the Varithena is now going to be inserted into the vein we're going to treat. The Varithena is a very gentle medication that interacts with the inner wall of the vein to get the vein to seal upon itself, and that directs blood flow away from this dysfunctional vein that directs it into the healthy veins that are flowing properly, thereby reduce the heaviness in her leg. All done through simple IV, that's it. There's a lot of surface veins that we're going to work on next here. We just hold a little pressure for about a minute and put a Band-Aid over here, and she'll have a compression wrap on her leg for 24 hours. This is a good example of how venous insufficiency can affect the health of the skin itself. Sclerotherapy is directed directly into these spider veins, and good injections, you'll see the veins actually disappear or erase. It works great, but it requires repeated treatments to get 100% resolution. This is an area that we treated about a week ago. This looks a little bit worse. It's actually been damaged by the solution, but then it heals by disappearing. So that's actually a good result. And just lotion and time, that'll clear up in a couple weeks to a couple months. All right, so we're gonna get some other areas. She's already been prepped, her skin cleaned up. The solution, polydocanol, displaces the blood in those veins, and that creates a healing process. And that is like the next stage it will do, but you can see this area is now clear. Over the injection areas, we place cotton balls and some silk tape, which holds some direct compression. And we'll put some compression bandage over her leg when we're all done with our treatment today. So she'll have this plus a Coban wrap up to the knee. But they're very comfortable. You sleep in them and take them off in the morning. You're gonna have brand new legs when we're all done with you.
I'm so excited.
You're gonna love these pictures too. It's never gets old watching that.
I cannot wait to go shopping.
We highly recommend retail therapy for post-procedural healing. This is really a dense patch of spider veins. The trick is finding the right vein to inject and see if you can kind of clean this area up. Let's see what we can get here. It's called sclerotherapy, also known as the magic eraser. We got 5 areas, and that's a good start. And the Varithena went super good. Everything looks good under the surface. From now on, we'll just concentrate on the sclerotherapy on her surface. But I think your legs are feeling better now, aren't they already? Keep applying lotion to the treated areas.
Okay.
If you're out in the sun, sunscreen over the treated areas. You have a really favorable outlook.
Yay.
I had the initial consultation, and then I had the ultrasound, and this is my 6th treatment on my legs. They're great. They are definitely not as bad as I thought they were gonna be. And I'm so looking forward to the results that any pain that it is worth it.
Go to cincyveins.com and schedule a consultation today. The Vein Center of Cincinnati, your center for vein health.